In today's video, we're going to be talking about how to get back to kneeling after a knee replacement, because this can be one of the hardest things people have to do after the surgery. Sometimes people never get back to kneeling, but I think that most people don't get back to kneeling because simply they don't train it properly. So in today's video, I'm going to show you exactly what you need to do to get back to kneeling. All right, to perform this routine, all you need is two things. A belt or a strap. This is a stretch strap that you can get online, but you can just get away with either like a belt or even a long towel too. We just need something to be able to wrap around the leg and stretch it. And then also you need a thick towel, so a beach towel or a bath towel will do, but something that's a little bit more robust that we can utilize to help improve the flexibility of this knee. So because kneeling requires so much knee flexion, we need to really work on this progressively. It's not gonna happen overnight, but over time, we can get more and more knee range of motion where we can comfortably kneel on the ground. So for the first exercise, we're gonna be using this towel. Now to start, we want a thick towel roll, similar to this. I'm gonna be putting this right in the back of the knee. This is gonna create a little bit more of an extra stretch and make it a little bit more comfortable where we're not maximally flexing it right away. We're gonna do it in a progressive manner. So to start, thick towel roll right behind the knee. We're gonna be grabbing our shin here. And what we're going to do is lightly bend that knee right over that towel roll. And we're gonna hold for about a count of 5 to 10 seconds. Make sure that pressure is tolerable. You don't want to be jumping off the table right away because otherwise you won't be able to relax. After that 5 to 10 seconds, we're going to relax and then bend again. We're going to do about 10 repetitions on each stage. So this is the first stage here. After about 10 repetitions of 5 to 10 second holds, we're going to unravel this towel slightly, put it right in the back of the knee, and we're going to repeat. So this is going to allow my knee to bend a little bit more over that towel roll now. 5 to 10 second holds and relax. And then after 10 repetitions, unravel it a little bit more, and eventually you're gonna be trying to do it without it. And you'll notice that over time, before you did the exercise and post, you're gonna be noticing your knees flexing a lot more already. Now that exercise is primarily targeting this knee joint here, but for kneeling, we also need to make sure that these muscles have enough flexibility to allow us to do so. So this next exercise, we're gonna need our belt or towel or strap, whatever you're using. We're gonna wrap it right around the ankle or shin here. And we do need a bed or a couch, whatever surface that's elevated, because we're gonna be dropping this leg off the edge and holding this belt. Allow that leg to drop down until you feel a stretch right in the front of the groin here. And then what you're gonna do is gently pull back, and you're gonna feel like a deeper stretch right in the front of the thigh. And this stretch is targeting the quadriceps muscle group, which is a muscle group that needs to have enough flexibility to elongate while we kneel. And again, with total knee replacements, this quadriceps muscle tends to just seize up on people, spasm, and it doesn't allow people to bend their knee much. So this exercise right here, this stretch, is an excellent way to get this quadriceps muscle greater flexibility, and it's gonna help us kneel. So this stretch, I usually like to hold this stretch for 30 seconds to a minute. After that count, we're gonna relax just for a pause of 5 seconds or so. And then we're gonna try to go a little bit deeper into the stretch now. Again, 30 seconds to a minute as tolerated. A longer duration is better. So if you can kind of get that mild stretch for a longer period of time, that's gonna enhance the value of the stretch. Try to breathe and relax while you do this. You don't wanna be tense because then that's gonna tense the muscle and you're not gonna be able to get as much out of it. And then relax. So the next exercise after that was a quadriceps muscle. Now we want to target the hip flexor muscle group. So that's the iliopsoas muscle group. That muscle lives way up here in the hip. So to perform this exercise, this stretch, I'm going to place the right in the front. So my left is the surgical leg, my right's the non-surgical leg. So I'm going to take on this stride stance. So you want to be holding on to something while you do this exercise because you don't want to be fighting with balance the whole time. You want to be able to relax so the muscle can stretch. So take on a big stride stance here. Now, before you move, I want you to try to position your pelvis backwards. So we're going to rotate that pelvis backwards here. You can do that by clenching this butt muscle. So clench that, and that's going to naturally tilt your pelvis backwards. And then you're going to get a better stretch, because you'll notice, watch how far I can go into this stretch. As I lunge forward, I can go pretty deep into the stretch without really feeling much, because I'm losing the stretch without stabilizing my pelvis. So stabilize the pelvis by clenching the butt here. We're going to pre-rotate this pelvis posteriorly. That's going to help elongate the front of the hip muscle here. And now all I'm going to do is just simply lunge forward, and I already feel the stretch. So you notice, it's clench, lunge. I can't go very far into this motion now if I do it properly before I feel that stretch. So if you're all the way down here, you're probably not doing the stretch properly. Clench the butt muscle, gently lunge forward here. That's going to open up the front of the hip, and now you'll start to feel this pull in the groin. You're going to hold it just like the other one, 30 seconds to a minute. Low load, low tension stretch, keep it light, and then back off about 5 seconds, and then back in. So I'm going to repeat this 3 times. Really opening up the front of the hip here, getting more flexibility. It's going to allow us to kneel more comfortably. All right, now the exercise that's going to make all the difference in the world here. So with total knee replacements, kneeling itself, just the pressure on the front of the knee can be uncomfortable. So it's always a good idea to cushion up for your kneecaps here. So throwing down some towels or even a yoga mat can be helpful. So we're going to start in what's called a tall kneeling position like this. And our goal is to ultimately be able to get back into a nice, comfortable kneeling position so that we can do whatever we need to do in this posture. So we're going to get this thick towel roll back, because this is going to allow us to progressively increase the depth of our kneel. We're going to make sure it's really nice and thick. We're going to put it right behind that surgical knee, right in the crease here. And to start, we're going to just start to slowly lower back. And it's good to always hold on here for a little bit of balance. But this is going to at least give us some support so we don't go so deep into the stretch where it's unbearable. It should be a tolerable, low intensity stretch, 5 to 10 second holds. And then we're going to come out of it, just give ourselves a little bit of a break, and then back on. 5 to 10 second holds. We're going to be doing this about 10 times. And then after the 10th repetition, we're going to slowly unravel this towel roll, put it right back in the back of the knee, and then sitting back again. So over time, as we progressively do this, 5 to 10 second holds, 10 reps, unravel it a little bit more, get deeper in the stretch, and then ultimately, we can eventually ditch the towel roll and then sit back on the heels. Now with the total knee replacement, this really might not be possible, but at least you have something to work your way towards this. If you can get all the way back here, excellent, to at least give you enough comfort to be able to get into this posture and do what you have to do. Well, there you have it, some nice strategies to get you back to kneeling. If you enjoyed this video, make sure you give it a like. It really helps support and grow the channel. And make sure you subscribe so you can stay up to date on everything you need to know about your body, how it works, and what it needs to keep moving.